Good morning, it's your ER pharmacist, Lil Pharma. We're combing through the new SCCM guidelines, and I just wanted to make a couple of videos, maybe like a little mini-series on the medication updates that I'm finding in these SCCM guidelines. And I wanted to start off with antibiotic selection. So there's a lot of new recommendations regarding antibiotic selection in these new guidelines. And one thing I actually really appreciate about it is that they are making recommendations against giving certain broad spectrum antibiotics or covering against certain bacteria empirically, which I think is really important because a lot of times in our sepsis patients, we just throw the kitchen sink at them automatically without really thinking about, does this patient have a high risk for some of these infections, like a multi-drug resistant infection or anaerobic infection. And the guidelines actually have a couple of blurbs in there suggesting against using these agents if the patients are at a low risk. So the recommendation states for adults with sepsis or septic shock at low risk of infection with a specific MDR pathogen, we suggest against using empirical antimicrobial therapy with coverage for this MDR pathogen. So they make the same recommendation for antifungal therapy and anaerobic therapy. So they say for adults with sepsis or septic shock without risk factors for anaerobic infection, we suggest using an empiric antibiotic regimen without anaerobic coverage. They also talk a lot about de-escalation, which I'll do a whole other video on that. But I think it's really interesting that they've decided to add these recommendations in, and I think it's going to be really helpful going forward so that we're not just giving the most broad spectrum antibiotics to all of our sepsis patients. We're kind of taking a few seconds to think about, one, what their source might be, and then what their history is, and do we actually need to cover for these multi-drug resistant pathogens and or anaerobic antifungal pathogens that may not be relevant in a classic sepsis case. So that's what I got for you guys on this one. I'll come back. We're going to do, like I said, I'll do a couple more videos because there are a lot of updates from these new guidelines and I'm really excited to get through them.